Yeah, now is a good time to be depressed. There are very effective treatments. We're a combination of hardware and software. We have our thoughts and we have our bodies, and they react in very strange ways. So for some people, the treatment of depression may be medicines. For some people, it may be psychological therapy. And for some people, it may be a combination. But we're into the area of evidence-based medicine. Psychiatrists and psychologists to look at what works and prove that it works. Okay, so how is depression treated? There are medicines, and they may not work immediately. They usually take at least a month or so to work, but they do work. Unfortunately, different people react differently, so they have to switch them around and see what works for a particular patient. And some people are helped by both medicine and psychotherapy together. The most common psychotherapy, which is proved to work, although there are others that work, is called cognitive behavioral therapy. Basically, your wrong thoughts make you depressed. Think in a different way. And teach clients to correct things like overgeneralization. Because you failed the exam doesn't mean you'll be a poor person on the street and will never get married. Filtering, only paying attention to minor things while ignoring the big picture. Discounting the positive, only paying attention to bad things. Jumping to conclusions, believing things are true without sufficient evidence. She smiled at me doesn't mean she's planning the wedding already. And mind reading. You cannot know what somebody else is thinking. I do not believe in extrasensory perception. I do not think we have telepathy. We may think we know what somebody is thinking, but unless we're talking about ourselves, we don't. Predictive thinking, we don't know for certain what will happen. You feel like you're in love. That doesn't mean you marry the girl or she's in love with you. Or you fought. That doesn't mean you'll never marry her. You just don't know. Life is complicated. And predictive thinking, we don't know for certain what will happen. You aced the test doesn't mean you'll be a Nobel Prize winner. You did well poorly doesn't mean you're going to flunk out of college. Magnification, we magnify negative events and minimize positive events. And oh, by the way, doing that is a big prediction. If you're a married couple, it's not going to be very happy. Emotional reasoning, because we think something must be true, it is true. Saying we should or must. Perfectionists say you should, you must do things my way, or the highway is an English expression. And labeling, you are stupid, or you're a genius. That's not a good way to behave. And personalization, just because something bad happens, we think it's everybody's fault. Maybe it's just a random event that had nothing to do with anybody. Catastrophizing, thinking disaster will come from one event. If your girlfriend breaks with you, it doesn't mean your life will end in disaster. And black and white thinking, everything is black or white. Either you're the best student in the class or the worst, or you have to get into Harvard or you must give up. and a Chinese website with information on CBT in both Chinese and English is www.cbtchina.com.cn. Okay, thank you.